I noticed on the chat, Bob Kaplow shared this on Facebook, but Raja is hosting, I did see this on Facebook. Raja is hosting 2 meet and greets next week. I did sign up for one. I believe I did sign up. I signed up for a couple things. I don't know where I'm going next week. I don't know where I'm going. But anyway, it definitely is a great opportunity. I was at the Palatine High School. He spoke. I heard just the last 15 minutes because I was at work. And it was really very educational, really a great session with Raja. We need to, and there were plenty of people there, but there could have been more. That's my opinion on it when he speaks. So do take advantage of that link that is there. Does anybody else have anything they want to share about what we heard? Or
John had his hand up. I don't know, maybe he had a
you
question.
see hands? You see hands? Michelle, you're so good at this. Michelle, who has her hand up?
Yes, I had my hand up. Yes, I had my hand up. I had an observation about on my Facebook page, a letter from a sheriff in Illinois about the House resolution on banning assault weapons, and his official page that was posted on Facebook says that him and many of his fellow sheriffs, elected sheriffs, will not enforce this in any way, shape, or form, including the checking on registration, and that it was his interpretation that the Second Amendment did not allow this. My opinion is that the police are there to monitor the law, and it is the judicial branch enforces the law. So since of the shootings in Illinois, and I live in Texas now, I grew up in St. Louis, so I have a lot of ties to Illinois. I was disturbed to see this attitude, and both of the school board candidates noted that they were willing to reach across the aisle and be conciliatory. But the fact is, the partisanship is there. And when I read this letter from the sheriff, I was not surprised. And I'm concerned about it as a Democrat and an American. And I wanted to ask that to the school board members.
I heard today on the radio too that with the passing of this, that right before it got passed, that there were 100 times more than usual larger guns that were sold and ammunition. So before the law became law, people just ran into to these stores and bought all kinds of stuff. It's just crazy, but that's a topic that could go on forever, I guess. I think keeping the schools safe is very difficult. I can truly believe how they as board members, as parents, as teachers, as children, it's not like it used to be. And that is too bad. And that can be a barrier for you as a parent, thinking you're part of the school, or that your child, comes in a little fearful. I mean, that we just never had growing up, and no child deserves that. But there are plenty of children everywhere that are having those feelings for sure. Yeah. Okay. Anybody else? It's going good today. We have Michelle, our co-lead, who is so good with technical, besides being so smart and a good leader. She has volunteered to do a PowerPoint for us on something that I think is important to all of us. And she brought up the topic of family leave, paid family leave, and how we are handling caring for those that we love. Michelle, are you there still?
Yes, I am still here, and I'm going to go ahead and share my screen if I can. And I think I can do that. So I put together a brief PowerPoint because that's what I do in my default
Wonderful.
Anyway, we'll go through it real quick, but this is meant to be interactive and we want to get your guys' inputs on what we want this group to focus on this year.
And
I was,
we have till 8:30, Michelle, okay? So we have
oh,
time.
well, I don't know that I have that much anyway, but I
Okay.
won't rush through it, okay? I'll not worry that I have to get everything done in 9 minutes because, but I only have 2/3 of what was promised. So there it is. Okay. But these are just some of the areas, and I was hoping I could do one of those polls that you can do on some Zoom accounts and have you guys, say what your top 2 focus areas are. But, feel free to put it in the chat. We have a lot of good suggestions up here, adequate and affordable housing right here in our area. Healthcare workers suffering from burnout. I think that ties along with the mental health topic we were talking about earlier, how to support our teachers, affordable childcare, which I'm going to get into in more detail because childcare is really expensive, food insecurity, helping families that are new to this country, refugees, recent immigrants, new citizens, whatever. I guess new citizens, it's the very end of a long process. Abortion access in Illinois. Now, I think maybe we've won the battle here in Illinois, but how can we help people out in neighboring states where rules are different? And, policies and attitudes to keep us safe. We touched on that a little bit earlier. And then paid family leave. So these are some of the things that came to our minds when Kathy, I think you had, this is largely taken out of the email that you sent around earlier. But, we don't know what's important to all of you. And we want some of you to take, we'd love to have one of you take one of these areas and run with it. Or if you know somebody who could speak to us in one of these areas, who's really well informed, because I am not, we'd love to have them talk to us, because this is kind of a building year for us, right? And it's a year we can do a lot of work and get things done. When we're in front of a big election, we're going to want to more, focus on the candidates and that kind of thing. So these are good years to get work done, and where do we want that work to be? So we'd really appreciate your input on that. Any feedback on that? Any thoughts there? I don't know if you guys are chatting. I see 5 things in the chat, so I'm not going to go look at them now, but Kathy or Bill, if you want to,
Yes.
chime in, because it's too hard for me to talk and read the chat at the same time. I'm not that technically advanced yet. So anyway, maybe
Domestic violence is one that was brought up. Kathy Risberg and I have spoken together, and she is working with Wings very intimately. And I believe that Kathy could help us have a speaker come, someone with who is from Wings. Maybe Kathy can also speak on her experience working with that group. So the domestic violence area is definitely something that paid family leave and affordable childcare. Elaine Fisher to everyone. Protect public education, says Joyce. Bob Kaplow, same. So I am very concerned about housing. I don't know how people are doing it. Honestly, I'm so grateful I have a place, but I worry about, and I get upset when maybe I know something did not pass in Palatine, where we were supposed to have a apartment building that had not been fully used, and yet people refused to vote for it. So I just think when you don't have a roof over your head, and I think a roof over your head can make a complete difference in your life. So maybe that would be something that I would like to look into. And if anybody else would like to help me with that worries me quite a bit.
Okay. All right, well, let's go on. So I'm going to talk a little bit tonight about family leave, and then about the state of childcare. And And that's all I've got. I don't think this is gonna go till 8:30, but anyway, if you guys interact with me, it'll go longer. And we love that. It'll be more interesting, put it that way. Okay, so what is the current state of family and medical leave? And right now in this country, it's pitiful. We have the Family and Medical Leave Act. I guess we should be grateful for that, but this is 12 weeks of unpaid leave in a 12-month period if you are facing, you know, one of these monumental things in your life, the birth of a child, you know, or taking in a new child for adoption or foster care. If you have a serious health condition and basically your immediate family here, if you yourself can't perform the functions of your job, you know, you can read them here. Service members get 26 weeks, again, unpaid. So how you're supposed to float yourself through this time is a really interesting question. And furthermore, the FMLA is only applies to employers who have 50 more employees. And then, you know, there's other restrictions on what workers are eligible for it. You have to have been, you know, 20 work weeks in the current calendar year. I know at one point my sister was looking into taking it when my mom died, and I believe you have to exhaust all your vacation first. And, you know, it's really, really tough to take this on, and you really need to take it in order to want to take it. And, you know, and it's brutal then because you're not going to get paid during this period. So it's anything but generous, and that's what we have, and we've had this in place. What, I didn't look up the history of this, but I want to say early 80s or something like this. So I don't think there's been a lot of movement here on this. So there are now some states that have paid family leave. And I thought this was interesting because I hadn't heard a lot about it in Illinois. But as you can see here from this list, I believe there's 10 states that are offering family leave now, with 2 more coming up. And look at this list. It's all the Northeast, from Massachusetts down to Delaware and Maryland, and the left coast, as they say, with the only 2 in the middle of the country being Colorado and then, shocker, Wisconsin, who somehow is going to begin offering paid family leave beginning in 2024. So that kind of surprised me. So, you know, where is Illinois on this list? But the programs cover, if there's only one number that applies to basically anybody who's eligible for the program. And if there's a second number, then the longer period is for yourself and the shorter period is for the other eligible person who would be covered under the program. The states vary by who you're allowed to be caring for if you're taking this program. You know, not all of them explicitly call out an in-law, and I think that's one of the areas where, you know, oftentimes you're called upon to care for the parent of a spouse, and some of them don't have that. All of spouses are eligible under all these. I just wrote that down as partner because I figured that encompassed spouse. So, and then a couple of the states like Colorado and then Delaware coming up, they just say anybody that you have a significant bond to, or Washington State here, anyone who's relying on you for care. So they're not going to say, well, you can't take care of your niece, even though maybe you've been responsible for raising your niece since she was 2 years old, you know? And so I think maybe that's the more forward way to look at the situation. But this is what we have here. So it immediately brought to mind the question then, what about Illinois? Here we are, we're this blue state. How come we don't have something like this? Well, there is a bill. Miranda, do you want to go ahead? I see a hand up there. If you want to break in, feel free.
Yeah, I think I'm sorry. I love what you've said and how you've compared everything, but I could have sworn, and I could be wrong, but I could have sworn I heard on the radio today the governor just signed a bill that was passed last week or this week that allows for 40 hours of paid family leave for anyone, and that includes hourly, food service people in the state of Illinois, which is a start. I'm not saying it's anywhere near what we need, but it's a start. And I think that that can be used as a springboard. And if I'm wrong, please tell me, but I think that's what I heard today.
I had not heard that, so I thank you for that, and we'll have to take that as a follow-up, because I had not heard that. But like you say, 40 hours does not compare very favorably to any of these. It almost sounds like it's kind of like some emergency thing. If you're, sick with something, you're going to get over pretty quickly. Like, maybe you have a bout of COVID or God forbid, whatever. Okay, but it's not going to take you through cancer, obviously. But there is a bill out there now in Illinois that would provide employees with up to 12 weeks of partially paid leave for FMLA reasons. And, it would also broaden the definition of family member, to include people that you have a family relationship with. And the cost for this massive program here is a whopping $3 a week, and we don't have this. To me, this seems like such a no-brainer. It's basically, it's not hard to fund this according to what I looked up here, and you can see my link. And I'm not saying I got any of this right. Like I said, I'm not an expert, so go out and double check all my work here. But anyway, the bill that I'm talking about is HB 5029. And the last action on it was about a year ago now, February 18th, 2022. It was referred to the House Rules Committee. It's Sonia Harper who is sponsoring this legislation from the 6th District. I don't know where that is. I guess I don't, I probably looked that up when I was putting this together. But anyway, so I don't know, if it's stuck there or what the deal is, but I know we have a lot of political connections in this group. So maybe we could figure that out and, better learn what's stalling this. Go ahead, Miranda.
Oh, sorry, I'm cooking dinner. That's all I really heard on NPR this afternoon. Some of the things that the governor had signed. Yeah. And that was one of the ones that he was touting. And like I said, it's not ideal, but it's a start. And I think if we're going to start pushing on it, like with a lot of other things, we need to stroke people and say, thank you, but let's go further.
Oh, sure. Yeah, I agree. Even 1 week is better than none, right? Okay. So that's all I had on that. Any other further comments on paid family leave?
I do know. Go ahead. I'm sorry. Now, what about like my nephew and his wife? She works for the Pentagon, and she has had her third child, and she had, I think, almost 6 months, but I don't think it was all paid. I think for corporations, some larger corporations nationally, maybe they pay for maybe the first 6 weeks or up to 3 months. Am I right? Or is it only that you have a job when you get back?
It can depend. I'm sorry, I worked in corporate benefits. It can depend on the company. It can depend on the rules that they put in place. Short-term disability, if you're not able to work, can be up to 3 to 6 months. Family medical leave, it really is at the discretion of the individual company.
And I think the companies that are larger and have more educated employees, I sense that they seem to get a better deal than a smaller company or a company that maybe just,
Sure, I
have-
think
If you work for
company-
Apple, you'll get better benefits than if you work for Walmart.
Right.
Yeah, that's true, right? If somebody's out there, they're trying to compete for the best, employees in some high-tech field or whatever. Yeah, you can bet that they're gonna try to offer a sweet benefits package. It's a
To
little
keep
bit
them there
better.
too, yeah.
And that would be part of the offering, right? So, anyway,
Bill, did you have a question? Your hand is up, Bill.
A statement. I looked it up, and today there was a statement issued by Governor Pritzker on Illinois.gov, January 11th, Wednesday, actually yesterday, said he issued a following statement on the passage of SB 208, the Paid Leave for All Workers Act. And it goes on to say that, he talks about the problems that everybody has, broken down cars, etc. But he says, I'm proud to say that the General Assembly has recognized that struggle and passed a bill guaranteeing 5 days of paid leave for all employees in our state. So it doesn't say that he signed the bill, but there is some action there, and that number is Senate Bill SB 208.
Bill, question, did it cover family members or, or just yourself? If you have a sick family member?
I'm reading it just. Like
Yeah,
you.
okay,
Uh,
okay.
I think it has to do with people like me. We have a small dental practice. We have me. I work full time. I have one other full timer. Everybody else is part time. And I think that this would pertain to all of our employees. I have one that works 25 hours a week. My judgment is that would cover, and I think, because I heard that, and of course, being a small business, I pay attention a little bit to it, but I think it's all workers. I don't think it's the bad thing. I think we can all do it,
Yeah, in reading it now, it says guaranteeing 5 days of paid leave for all employees in our state. When I first read it, I thought it said state employees, but it is all employees in our state. Now, I think that maybe the Senate and the House have to come together because the one that Michelle has up is HB. That's a House bill, 5029. And then they'll come together with a compromise, and then Pritzker will start it. But the good news is all bills have to start out fairly small, and then we can grow and develop them. So this is really good news. And I wouldn't have looked that up had not somebody said something about it.
Yeah, that's very good. And I
it's
don't
only
know.
2 paragraphs.
And Michelle, maybe another topic too would be, and it would be good to have some of these young moms. Well, you have a young mom, your daughter, right? With daycare.
Right.
I know it's
Well, that brings me right into the next topic, unless
Okay.
there's anything else more on paid family leave from anybody. And I don't know if those of you who have your hands up, I'm not sure if you still have questions or if you just didn't put your hands down. So go ahead and talk. Anybody who has a question still or wants to make a comment or whatever. Okay, so Miranda, your hand is still up, but thank you for your
I'm
comments.
sorry.
And you're so much more up on this than I am. So a valuable asset to our group. And thank you for bringing that to my attention because wow, I really missed that one in my research.
No, I honestly didn't even know it had passed, or it passed at least one. My concern is that now we're starting a whole new session, so it has to start all over again, but it's definitely something that is worth considering getting behind, if not
in the
expanding.
works.
Right. And maybe one of our politicos, like I know we have connections to several of these House and Illinois House and state senators. And, maybe they can give us a view into, what's going on there. Because surely the House bill is, you know, more along the lines of what we'd ultimately love to have, but yeah, if we can only get a week, we'll take it. That's good. So, okay, so this is childcare, the state of childcare, in the nation here, as far as I understand it anyway. And again, subject to many mistakes, so please do your own research on this. But this is how, this is what I got off one site that's vowing to change childcare, and I'm not sure what they mean by that at all, but they had some notes here that in Illinois, rent averages $1,098 a month, while childcare for an infant is $1,150 per month on average. So think of what that means. That means that if you've got 2 kids in daycare, 2 little kids, like my daughter does, because we've got a 2-year-old and a 4-year-old, you are easily paying $20,000 to $25,000 a year in childcare. Wow, that's like putting somebody through college, right? I mean, these are phenomenally high numbers. So, what relief do we have available? Well, there's some relief for low income families out there, but look, and that's great, but I mean, you're already so poor. I mean, this is hopefully you don't have to pay anything at all. But there's the poverty guidelines, and these are from 2022 or something. The 2023 poverty guidelines don't come out until tomorrow, or no, next week or something. I don't know. They're not out yet. But anyway, if you're trying to parent somebody on a child on $18,000 a year, good luck. I have no idea how you do that in the northwest suburbs of Chicago. To me, that looks, completely impossible, let alone a family of 4 on 23,000. So yeah, you'd have to have help, and I guess there's help available in that situation, and that's great. Now, I remember from back when I was a parent of a school-age child, the flexible spending accounts were just coming in at that point. And, back in the day, you could pretty much deduct all your expenses, but I understand there's a $5,000 cap now on this program. It's use it or lose it, although there is a small amount of carryover now allowed. But again, $5,000 isn't really gonna, and you don't save $5,000, you save the tax on $5,000. So whatever that comes out to, 1,000 or 1,200 or, whatever. But, that would be coming off your total bill of $12,000 or $15,000 a year, or even double that if you have a couple of kids that need daycare when they're really small. So that might have been a lot of relief when the program was introduced, but it's not so much relief now. And then we have the Child Independent Care Credit, which was very generous in 2021 when everybody was dealing with the pandemic. We had the $4,000 credit for 1 kid, $8,000 credit for 2 kids. And that was great, but it ran only for the 2021 tax year, as I understand it. And then we have the Earned Income Credit, but I think you have to be under about 59,000 in order to qualify for that. So, talk about a donut hole here. There's a huge donut hole for people who are not, impoverished, but also are not, wealthy, really wealthy, to come up with enough money to cover childcare, because you're going to go from not having this expense to adding on $1,000 or $1,100 expense when you need to put that first child in daycare, and then you have the second, you're going to double that. So, you might have what was your mortgage payment or your rent. Now you're doubling and tripling that amount to manage, keep your kids in daycare so you can go to work. So I look at that like a few crumbs from the government. So what was in the Build Back Better proposal? This didn't pass, but this was part of the Biden Build Back Better plan. And I got this off of some website that had to do with Maine, the state of Maine, but I tweaked it a little bit. So again, I hope I got this generally right. but it would have, for families earning up to 75% of the state median income, which I think in Illinois would, that 75% would translate to about 60,000, you would get 75, you would get free childcare. And then if you were above that threshold, there would be some sliding scale, but it would eventually be capped at 7% of your income for highest income earners, which would mean that if you were a family of 4 with an annual income of 100,000, then you would not be paying any more than 7,000 towards daycare, which would probably cut your daycare bill in half. That would be real relief. If you had 2 kids, it would cut your daycare bill by 75%. You know, that's real help there. You know, it was intended to have universal pre-K for 3 and 4-year-olds. Well, wow, that would, you know, then you'd only be in that childcare hole until your child was 3 years old. And then a permanent expansion of the child independent care credit that we saw that 1 year in 2021. And then a minimum wage for childcare workers, because, you know, they're notoriously poorly paid, and you can see why, because it's such an expensive proposition for parents in the first place. But we need to ensure that our childcare workers are also properly paid. So anyway, now this, unlike the $3 per week that it costs to do the Paid Family Leave Act, if you believe that earlier slide, this was a $450 billion 10-year investment over 10 years. So it's a much more expensive program to fund, but hopefully it pays off in the back end, because you've got these children that are, you know, better equipped coming to school, and families are more free to, you know, not being under the gun so much, and they're going to be more productive and happier and you know, better off because for this. So anyway, I just wanted to refresh everybody as to what was in there, because I think a lot went down when certain senators were not interested in that. And that's all I have. But, you know, elder care seemed to be really complicated. And the one takeaway I had from it that I'll share is it seems to be a growing recognition that caring for somebody who's really sick, when you're, just because they're your spouse or your family member or something, shouldn't be taken as a given. You know, I mean, you're replacing a service that costs thousands and thousands and thousands of dollars. It's impacting your own ability to have your normal life. And you know, I in some ways, it seems like there's, you know, recognition that there should be some support for these kind of things. But like I said, I haven't gotten really anywhere towards a presentation on that or anything that I could show on a slide. And if somebody wants to take that up, we'd be really, really grateful for that. So that's all I have here. And maybe there's some feedback. I see there's 7 things in the chat, and maybe somebody wants to talk about that.
Let me read about the chat. I didn't look at the chat.
I think there might be a question out there also.
Let me see. Just run this down. I want to just say that my daughter lives in Milwaukee, and when her 2 boys, they have K4 in Milwaukee, in Wisconsin maybe, where they go to school when they're 4 years old. So they do kindergarten basically 2 years, you know, K4 and K5. So it's public school teachers. It's in a public school building. The teachers are getting paid very adequately. The parents know it's going to be every day, and it's all day, and they have after school program also. I was amazed. I'm saying, why doesn't Illinois have this? And that's what Biden wants to do. He wants to make it so that the teachers themselves are getting paid what they deserve. But we as taxpayers, so I'm going to be paying, you know, for somebody else's child to be at 3 years of age to be in a school. So what? How wonderful! I'm investing in that child. I just feel all of this is
nobody thinks it's weird to pay for a 5-year-old or a 6-year-old, right? And yeah, they're getting education, but they're also getting daycare, right? I mean, if they weren't in school,
right,
Somebody'd have to be there taking care of them. So, why is it such a hurdle for 3 and 4-year-olds? Yeah, I think New York might be another place where there's universal Head Start or something in New York. New York City, I want to say New York City. But I'm not 100% sure about that either. But, yeah, nationwide, there isn't something. So it's interesting to see that Wisconsin has a couple of things going that we don't. Yeah, so we should keep our eyes on that.
I do have a patient, and she was very involved in Head Start. She has a degree in education, and now she's working with something that's very similar. And I brought this up to her about K3 and K4. And she says, well, wait a minute, that's going to take away from my department, because that's what she does. She works with those preschoolers. And I'm looking at her like, oh my goodness, well, there you go. But I don't think she gets paid nearly as well as if she were in a classroom. You know what I'm saying? That would be hooked right into the K through 8. So I think everybody would be a winner that way, but I don't think it's anything close by that we're going to do. So I should have her come and talk sometime. She is involved in the Head Start type programs. So we could hear what that goes on there.
Yeah. Miranda has her hand up.
Yeah, I'm sorry. I thought I listened to Governor Pritzker today, this week. And one of the things that he mentioned as his goals was universal pre-K or universal childcare for the state of Illinois, which I'm totally behind. I hope it's more successful than the tax thing, which predicated so many other things, including the healthcare stuff. But that's something that, again, I would recommend taking a look at, because I think that's one of his goals for this session is universal childcare, regardless of income. But again, I don't know the specifics on it. But I think it definitely is something that should be a priority. But if that's one of the things they're looking at, again, that's something that we can lean into,
Right.
And support from that way and find out how they would prefer messaging, yada, yada. So that's all.
Thank you. Elaine Fisher wrote, Women Employed is coordinating a statewide coalition that AAUW is part of. Last session, they did not have enough votes to pass, so it was postponed to the new session. They would have paid leave for sick leave and family medical leave through cost sharing insurance. I don't know what that all means, but that's something that is interesting to look into. And then Sue Harvey wrote, children will do better in school with a strong preschool experience, for sure. And preschool teachers are being taken advantage of. Sue Harvey wrote, affordable childcare is related to supporting teachers. Childcare teachers are taken advantage of. Definitely, definitely. There's a huge variation in quality of preschool. And the financial transaction tax would help fund schools.
There's also a shortage. I'm sorry to jump in. There's also a shortage of qualified health childcare places since the pandemic. A lot of them shut down because they just couldn't make ends meet, and a lot of them were out of people's homes. So we've lost a significant proportion of private childcare.
And I know in a lot of your minority families, it's all very, grandmother will care. An aunt, one of my employees, she can't work on Mondays and Wednesdays because she takes care of her niece. So there's that, very family oriented, but then she can't get a full-time job and maybe progress in what she wants to do. So I noticed since the pandemic, there's a lot more of that, where people are just counting on a more casual, but very important type of daycare for their families. Michelle, good job.
Thank you. Yeah, I didn't know that there were 10 states out there that had paid family medical leave. So, and 2 more coming up. So that was really enlightening for me because I wasn't aware of that. And I wasn't aware of these bills. I think we should, pay attention to that.
Maybe keep tabs on it. Yeah, maybe every couple months kind of bring up what the state of things are and
Right, and if there's, sometimes there's a time for witness slips and that type of thing, and, just lend our support where we can.
right.
Where we can for that kind of thing.
Right.
So, okay,
Anybody have anything else to share? We've got just a couple minutes left. This was good.
This is Miranda again. I'm so sorry. If
we
you
love
want to
it.
talk about elder care, I lost my mom in September, and it was horrific.
Oh, I'm
Trying to
sorry.
find her somewhere to be, and the fact that the number of nursing homes in this state that won't take somebody who is Medicaid, what's the word, pending,
Pending.
and
Mhm.
and finding out that there are people in charge of nursing homes that don't even know you can get expedited Medicaid approval. It was really quite horrible, and the fact that not only would a facility get Medicare and Medicaid, which totally makes sense, but they get to take the Social Security check too. The state passed a thing. I'm sorry, this is something I'm hot about. The state passed a rule to stop the clawback thing, which was an issue for a long time and still is under federal law, where any money's given for residential care under Medicaid can be clawed back from the estate after the patient dies. And the state
boy.
stopped that last year when they passed the legislation on it. But this should not be this hard. Finding out that hospitals, at least the hospital we were with, which is a really good one, doesn't have one person who follows a patient all the way through. The social workers change floor to floor. Social workers don't go out and check out nursing homes anymore. There's a lot of serious issues with death with dignity and a whole bunch of other issues with elder care that I'm totally happy to riff on with anybody at any time.
Well, Miranda, you've got a lot of good information, and we'd love to have you run with this and brief us for 15 minutes next time or the time after that or something.
I'm still working on coming to terms with everything, but I don't know if you guys
Yeah.
know, I'm the executive director of ACA Consumer Advocacy. I try to stop in when I can, but healthcare is really kind of my bailiwick. So anything that's related to that, I try and stay on top of.
Wonderful.
Yeah, because you know a lot more about it than I do. Wow. That's great.
Because I have nothing else to do.
I know my mother-in-law, she passed away 8 years ago, and we were fortunate enough where we did at that time find a place that did do Medicare pending and our Medicaid pending, I should say. They did take her Social Security. She did not have a home anymore. She lived with us. But you know what? It ended up that they didn't follow through with all the paperwork and it had to be resubmitted. But they really didn't put the burden back on my husband or myself. We had lots of paperwork, gobs of paperwork to do to make this work for her. And she was in a nursing facility, I think a total of 11 months. But I don't know if it's that easy anymore. I kind of, from what I'm hearing, Miranda, what you're saying is more of the situation. It's we were blessed. We went to Place for Mom is where we went, and they helped us.
One of the things people need to be careful of, I'm sorry to cut you off.
Okay, that's all right.
I called them too, and they specifically told me that they only did private care. They did not work with Medicaid at all. And they told me that the cost of what she would need based on what I told them was $4,500 a day.
Okay, there you go.
$4,500 a day in medical care. Thank you very much. It was really, I'm already in touch with my state rep and state senator, and I need to write this up and work on it. but it shouldn't be this hard. It really shouldn't. It shouldn't be a fact that people who have a terminal illness can't decide when they're still cognizant that they're done and they don't want whatever disease they have to eat their brain. You
Right.
know, I'm just, I have
Miranda,
feelings, and I'm
you-
sorry.
No, this is where we need to hear it. That's okay.
Yeah,
Sounds
I
like-
went through a cousin of mine who has Parkinson's, her husband was dying in November of prostate cancer. And I went twice in October and November to help her husband, because her Parkinson's is pretty advanced, and they were attempting hospice at home, which, you know, they got through. He died peacefully at home.
Okay.
What is expected of people to do on their own is, to my mind, kind of shocking. You know, the nurse was coming in once a week, twice a week. I mean, yeah, for 1
Right.
hour.
And if you have hospice, it's once a week. They will be there once a week if they have hospice, or
Yeah.
maybe twice a week. Or, you know, you have hospice and you say, oh, the person wants to donate their body. Okay, we'll take care of it next week. No, they died the next day. So the family's in charge of taking care of that. Another issue is how banks deal with dead people. They will nickel and dime an account to death, so there's nothing left.
Hmm.
If you have less than $10,000, $15,000 in the bank, the family's screwed, especially
Wow.
if they sign them up for a program that they never should have been signed up for. And, you know, it's just, oh, there's so many things I'm hot about. I'm sorry to take over the call. I really am. I'm very angry.
Okay.
Yeah, it's a lot of stuff we should all be, you know, more aware of. It's going to hit all of us at some point, right?
Yeah,
And
it is.
hopefully we can, you know, make things better now, so that it's not so harsh for us when, you know, and our loved ones when we hit that than it already has been. But I think we're coming up on 8:30 here, so
Yeah.
maybe we want to wrap it up. And I think we've had a good discussion, and it's so great to see so many people here, and we love having you all here. And
And let's keep
so
tabs on some of
gratifying.
these topics. I think it's great. Let's not let things drop completely. Let's see if maybe we can find out more information, or if there's a bill that's, you know, ready to be looked at. As you say, we can maybe get some support where it's supposed to be. We will let you know when the next meeting is. This was kind of the 12th. This is a Thursday. I'm not sure that's always everybody's best night, being the first part of the month, but Michelle and I will maybe figure out a day that works better. And although we had a great group tonight, so that's wonderful. We want to thank everybody, and you'll get another email from us. And I've got, I know I'll have everybody's names so that we can be contacting you for more, you know, more things that are happening. All right. Thank you, and have a great rest of your evening and a great week. Thank you all.